Hi, hello, welcome back. So today we will be discussing about ENM coding questions with answers part 4. So in this we will be discussing about the important questions which are asked during the ENM interview process. So if you haven't watched the previous parts, I'll add up the link here so that you can go through that questions also for your reference. So let's get into the video. Welcome to Learn with Dhanya. In this video, we'll be talking about the most important interview questions for freshers, medical coders, and how to prepare for your interview. Before getting into the video, if you haven't subscribed, please do subscribe and watch the video completely. Don't skip in between and don't miss any of the questions. So the first question here is counseling and coordination of care. So, this is a part of the visit where the provider talks with the patient or family about the health problem or coordinate the patient's care. Counseling means explaining the diagnosis, discussing treatment option. Coordination of care means communicating with other healthcare providers, ordering tests or referrals, making plans or follow-ups. Next important rule in this counseling and coordination is if more than 50% of the encounter is spent on counseling or coordination, you can use the time-based coding to select the ENM code. For example, if a patient is with diabetes, spends 25 minutes with the doctor, 15 minutes discussion for blood sugar and 10 minutes review of lab and tests. So based on that, you will be giving the code. And next question, prolonged service in ENM coding. Prolonged service is a time spent with a patient beyond the usual ENM service time for that specific code. It is in addition to the standard time for the ENM level. When it is used, face-to-face time with the patient exceeds the usual time of ENM code. Non-face-to-face time key points must document the total time and note it was beyond the typical ENM time code and usually reported with add-on codes like 99417 for outpatient or office patient for prolonged service. Example, ENM code 99214 is 30 to 39 minutes. Doctor spent 50 minutes with the patient total time. So the next question is, what is split or shared visit? A split or shared visit is an ENM service performed jointly by a physician and a non-physician practitioner like a nurse practitioner or physician assistant in the same group of practice on the same day for the same patient. The provider who performs the substantive portion more than 50% of the total time or key components bill this service. Next question, what are incident to service? Incident to refers to the service provided by a non-physician practitioner like nurse or physician assistant under the direct supervision of a physician. These service must be a part of the patient established care plan created by the physician. The physician must be present in the office suite and available for the supervision. Next question, what are preventive medicine services? Preventive medicine means keeping a healthy person healthy. It's about preventing the disease, not treating it. So these services focus on early detection of the diseases, routine health checkup, patient counseling about diet, exercise, vaccination, etc., screening like BP, cholesterol, pap smear, etc. These visits are not problem oriented. Example to understand it easily. A 25-year-old woman visits for her annual physical exam. She has no complaints, just a general health checkup. So here we will be coding for preventive visit 99395. In second scenario, 40-year-old man visits for routine checkup but he has chest pain. So here we report two codes 99396 for preventive and 99213 for evaluation and management service. Next is, what is concurrent care? Concurrent care means two or more physicians are treating the same patient at the same time but for different medical conditions for different parts of care. So it is a shared care. Multiple doctors are involved in treating one patient but each doctor care is medically necessary and distinct. Imagine a patient example you can go through. Okay. 37. What is transfer of care? Transfer of care happens when one physician completely hand over the responsibility for a patient's care for a specific condition to another patient. Example, let's say primary care physician is treating patient with diabetes. Now he is deciding the endocrinologist should take care of the full diabetes management. Here he is fully handing over the patient to the endocrinologist. So it is a transfer of care. Example, physician is referring a patient with CKD to a nephrologist and asks the nephrologist to manage for going forward. So it is a transfer of care. Whereas if a cardiologist only give advice and the physician still manages the condition, then it is a consultation. It is not transfer of care. Difference between consultation and transfer of care. Consultation means a provider is seeking another physician advice or opinion but still keeps responsibility for the patients of care, that is consultation. Transfer means one physician completely hand over the responsibility for the patient treatment to another physician, that is called as transfer of care. Next question, difference between initial and subsequent service. Initial means the first time a provider sees a patient during the hospital stay, skilled nursing care facility or a new course of outpatient treatment. The provider is responsible for the admission or beginning of the care of the encounter. So here the hospital initial visit 99221 to 223. Nursing care initial care is 99304 to 306. Whereas subsequent service means follow-up visit by the same provider after the initial service, usually for ongoing management, progress checkup or treatment updates. So here for subsequent care, hospital subsequent visit 99231 to 99233. Nursing facility subsequent care 99307 to 310. Office or established 99212 to 99215. Last question, global period in medical coding. Global period, also called as global surgical package, is a time frame during which all services related to surgical procedure are included in the procedure's payment and cannot be billed separately. It covers preoperative, intraoperative and postoperative care that is directly related to the surgery. So here we have types of global period. 0-day global period means only the day of surgery. No pre-op or post-op care is included. 10-day global period means it includes a day of surgery and 10 days after, common for minor surgeries. 90 days means it includes pre-op, day of surgery and post-op. Common major surgeries like appendectomy or CABG procedures, all that. What is included in the global package? Pre-op visit 1 day before the major surgery, intraoperative services, post-operative follow-up visit, typical post-op pain management. What is not included? Unrelated evaluation and management service, complication during the procedure, diagnostic test or unrelated procedure, post-op care for unrelated services. In short, the global period means that after a surgery, a certain follow-up visit and services are already paid for under the surgical code. You can only bill separately if the E&M service is unrelated or involves a different condition. Example, a patient undergoes appendectomy, 90 days global period. The same surgeon sees the patient 2 weeks after for wound checkup. Here it is unrelated procedure, so it cannot be billed together. So that's all about today's 10 questions. And if like for previous question, you can just check out the link which I am sharing here. Please do go through that question also. That will be really helpful for you to prepare for your interview. If you are looking for interview guidance training program, you can join with us. So a complete guidance will be provided. Thank you so much for watching. If you haven't subscribed, please do subscribe and share it with your friends also. Thank you so much for your time. Take care. Bye-bye.